name is Dr. Ricardo Komotar, and I am professor and program director at the University of Miami. I'm also surgical director of the Brain Tumor Institute here at the Sylvester Brain Tumor Cancer Center. I wanted to briefly discuss today the Vycor minimally invasive cannular system, the VBAS system. It has been instrumental in our tumor practice. As background, here at the University of Miami, we have one of the largest brain tumor treatment centers in the country, if not the world. We perform nearly 2,000 brain tumor surgeries per year. And the Vycor minimally invasive cannular system has played an integral role in our volume, patient outcomes, and overall patient satisfaction. And I'll be discussing a little bit about what makes the Vycor system so unique. So typically Vycor, which is as we discussed, a minimally invasive cannular system, it is typically used for deep-seated tumors that otherwise would not be safely accessed. So for example, deep-seated gliomas, deep-seated metastases, tumors that would typically require a large transcortical approach or an interhemispheric approach that would have a high risk of a venous infarct or other morbidities during the surgery can now be more safely approached via the Vycor system, which instead of damaging the brain, simply splits the fibers on the way down to the tumor. The tumors that are deep-seated, that have failed radiation, that are not amenable to laser ablation, these are perfect cases for the Vycor minimally invasive cannular system. The benefits are it's minimally invasive, it requires a small incision, minimal to no hair shave, and then much less transgression of normal brain, which you would have to typically go through if you didn't have this technology. The tube can also be passed via stereotaxy, so your trajectory and your entry point and your target point are very carefully selected during the procedure, making it incredibly safe for properly indicated and carefully selected cases. The cases that we use most for Vycor would be deep-seated tumors, deep-seated metastases, especially ones that have failed radiation, deep-seated gliomas, ones where you don't want to violate much cortical surface on the way down to it. And also intraventricular tumors is another example of tumors that you can access quickly, safely, and effectively using the Vycor system. So colloid cysts, subependymomas, central neurocytomas, you can approach them most commonly through a transcortical frontal approach that is very well tolerated and have an excellent view and visibility of the interventricular area, the ependyma, the choroid, the septum, and then the tumor, and then safely in a bimanual technique remove the tumor as opposed to an endoscopic technique where you don't have the bimanual techniques to dissect and carefully remove the tumor and block many times. I feel it's beneficial from a surgeon's perspective because tumors that would otherwise carry a very high surgical morbidity without other treatment options are now much more accessible, much safer to remove, and the patients maintain their quality of life with minimal morbidity. When you discuss the data on this technology, because it is relatively new, meaning coming into play only in the last decade or so, the group here at Miami has been instrumental and pioneering several of the clinical studies looking at the use of Vycor minimally invasive cannular systems for tumors. We've published a very large series based on colloid cysts, subcortical tumors, and deep-seated gliomas, showing that the Vycor system can be used safely and effectively. It requires minimal investment in terms of new technology. It's used with a conventional microscope, and the otherwise OR setup is very traditional. When you discuss the benefits for the patients, obviously being able to remove tumors that otherwise could not be removed is the biggest benefit, but also the fact that you can access these tumors through minimally invasive approaches with relatively small incisions, no hair shave. These patients have less pain, shorter hospital stays, they go home quicker, and as a result, there are less complications. I believe it's a very useful addition to any neurosurgeon's practice who treats a variety of complex brain tumors. Here at the University of Miami, we treat the full gamut of brain tumors, whether benign, malignant, and the Vycor minimally invasive cannular system has become a central part of our armamentarium, being able to treat these tumors that otherwise would be much more difficult to treat. So the learning curve as well for this technique is very steep, meaning that you very quickly become comfortable with it since the bimanual technique is very similar to open traditional craniotomies. We are pioneers in the system. We are big advocates in the system, and we welcome any questions or concerns about the system to be directed to us. We are always willing to have cases proctored, to have interested neurosurgeons come evaluate this technique and see how it's used. We believe it is the future of minimally invasive brain tumor surgery.